You know it's about to be intense when the gloves come on. Usually when the gloves come off, but all right. So we have a lot of work to do. We have scarring here.
Minor surgery.
Yeah. Of what?
What's it called when you like a fat pocket?
Okay. Lipoma?
Yeah.
How's the neck comfortable in that position?
Mm-hmm.
So we're gonna do some Graston on this patient. I lifted the table to save my own back because this is gonna take some time. We have different muscle segments that we need to address. I usually try to do 1 to 2 muscle groups per visit, but patient comes from far away, she travels, so when she's in here, we're just gonna try to get it all done and she doesn't mind. Next, comfortable?
Mm-hmm.
It's got a little superficial. Let's drop your arm down. Good. Yeah, you could already tell. It's getting the reaction we want. How's the pressure?
It's okay.
This is superficial.
Mm-hmm.
Yeah. So, especially these types of treatments, we have to schedule patients in a time slot according to one-on-one time spent with the doctor. Because this is not something you want to go in and out multiple patients, okay? Okay. And I do depress the shoulder blade just to bring those muscle groups a little more superficial, okay? As much as we can, we try to go upwards towards the heart. Yeah. The faster it gets red, the more injured that muscle fiber is. All right. Okay, we're getting close. There's gonna be some ribs here, so if it's too tender, just let me know. So we addressed one side, now we're gonna do the other. Okay. More hypertonic for this muscle group on this side compared to the left. Okay. Let's change up my tool. Concept's the same. This will just help get in between the ribs a little better. Patient was complaining of increased pain in this region right here, so I'm gonna scrape, try to feel for anything unusual as far as injury, scar tissue. How you doing? You're doing.
I'm just discovering that when other people have Graston me, it's been a very different experience.
When other people, what
When
you?
Graston me, it's been a very different experience.
You Graston people?
No. When other people have done me, I'm like, oh, it's a very different experience. That's when I'm like, oh, it'll be fine. I'm like, oh, okay, this is what you meant.
Yeah. Oh, you ask people like, what is it?
No, I've had it done with other people. They said you're very effective is what I'm trying
Yes.
to say.
So this does take a lot of one-on-one time from me and the patient, and they're gonna go through the uncomfortable stages of Graston. So I usually like to approach it as, if we're gonna be here, we're gonna get it done, let's just go all out, save you multiple visits, right?
Mm-hmm.
You're gonna be sore, might as well just be sore one time. And yes, you could go more conservative, but I'm an extremist personality. It's all or nothing, so this is what you get with me. If you want something more therapeutic, gentle, we have other doctors who fit the bill for that as well, okay? But I'm known to unleash the Kraken. All right, right here. Drop your arm, thank you. Boy. 5, 4, 3, 2, 1. Breathe. We're not even like 20% done. I mean, we can divide them into different visits. It's up to you.
Let's do it. As long as it works for you.
Yeah. But we scheduled you weeks in advance to have this time, so we're gonna use it up. Oh yeah. On it. There it is. Okay, 3, 2, 1. Woo! You wonder why I say I don't work out literally. My job is.
So Lily said you like hurt your back or something. All the shit.
Yeah, and that's why, all my tables have the hydraulic system because everyone is a different height. So imagine if I didn't set this up in the right height, I would be bending down and
Not good for you.
I'm gonna need this done. Okay. Anywhere else in this region you feel like we haven't addressed?
Feels pretty fired up to me.
Yeah, well, it is gonna feel like burning.
Mm-hmm.
Best description I've had from patients is like when you descale a fish, honestly. But okay, so I think we should go seated. Let me just move from here and then move to the front. So we're gonna.
It's Sanskrit. Hold on, I have a lot of tattoos. I gotta remember which one. It basically means like coming full circle, coming back around.
There you go. All right, we're gonna do chin to chest. All right. And then definitely want to get the suboccipitals, especially now and nowadays everyone's on their phones, computer. This is very overused. In school, we called it Dos Equis muscles or the what's up muscles because literally this is all it does. You want to look real quick?
Oh.
So literally that muscle, all it does is literally that.
Okay.
So phone, computer, everyone's, and these give very bad headaches. Obviously, making sure we don't go over bony structures as aggressive, right?
Mm-hmm.
Okay. No, naturally you're gonna guard, and that's why I'm grabbing your head and right in there, right? Okay. Yep. These are not gonna be fun.
You should offer those like balls to grab.
You want a stress ball?
Do you have one? It's okay. Don't worry about it. Just saying.
I used to, but it. We do the traps. You can see inflammation on the scalenes here. We call this one the handlebar. Yeah. Oh yeah, you thought it was gonna be better? No, this is actually, I think, the least painful because there's more surface
Right.
area.
Yeah.
If I were you, use the stress ball on your left hand.
Okay.
Use your right hand and grab the bottom.
Okay.
There we go. So what that does, it depresses the shoulder,
Yeah.
exposes more area of the traps for me. Yeah. You want me to go lighter?
Just on that bone, if you don't
Okay.
mind, just a little toward the end.
Gotcha. Tilt to the left. And then your whole body. There we go. All right. Is that better? Scalings are not pleasant
No.
at all. So maybe I'll just go in and dig in like this. Oh boy. So if these get tight, they could be one of the many things that cause TOS, thoracic outlet syndrome.
What's that?
So your nerves for the neck come out in this region. Okay, so that is located right in front of it.
Got
So
it.
if it gets too tight, it could push on the cervical plexus, and it can mimic like a disc injury or radiculopathy, which is known as tingling, radiating symptoms down your arms. Okay. Another one of those is tight pec minor. People born with cervical ribs. All right. And if we broke it up, it is gonna get a good histamine response. Very
I'm gonna start
unpleasant.
sneezing.
Huh?
I'm gonna start sneezing.
Histamine, as in, so when we break tissue,
Yeah.
like when you twist your ankle swells up. So
Yeah.
that's histamine to stabilize and immobilize the region. So now that histamine is going in that area, it like concentrates all this repairing factors in there. So it did actually. I don't know if we could do it before or after, which is a good thing. See how it's swollen? It should be a groove, okay?
That one's,
Maybe I'll do the trap first.
yeah. That's
Warm you out. Stressful. There we go. You read my mind. But this is like the worst. Yeah, right there. Dang. I'll check this out, Stacey. See how much redder that area got, and I barely touched it.
barely touched. That's
Barely.
not what I would call it.
Is that okay? It's going over the scar?
And it's a little rough on that scar.
Okay.
The surgery wasn't that long ago.
Okay, so we're gonna avoid that area, okay? There it is. 5, 4, 3, 2, 1. Good. Take a minute.
Good times.
Look at that.
Like, you basically look like Dexter, just so you know.
Yeah. I actually just started watching that show,
It's a great
and
show.
I just realized that I don't know where I heard it from, but surprise, mother, that was from that show. So, yeah. There's a prequel coming out.
Oh, really? I don't think I've seen that.
So, future chiros out there, obviously, when you go in this region, you gotta be very cautious with the carotid artery right under the SCM, right? And then you never do 2 scalings at the same time. If I remember correctly, there is like a node there that can cause the patient to pass out. So we always address one side at a time. If for anything, I don't think anyone in the world could tolerate both of them at the same time being done. Okay. There we go. Good. Right there. Good. Yep.
Ooh, shit. That is a mean mother.
Yep. Alright. The original full one, but we couldn't find it last time. gentle here, okay? So I do want to address it, but my goal is not to make it bruised up. A lot of. Okay. There we go. Did you feel it loosen up?
I don't know.
I did.
Sorry.
No worries.
I'm a little distracted right
Really? From what?
now. Oh,
You really want me to do scalings? I gotta go with this hook. I'm not doing that today.
you're not? Okay.
No.
Next
I don't-
time?
You really want me to? I mean,
Just
I
okay.
okay.
More than, at this point, what's the matter?
Just like turn. There we go.
Is that better?
Mm-hmm. Again, we don't go deep or aggressive here. We just try to address it as superficial as we can. There we go. Okay, and I like to get around the mastoid area, okay, because that's where it inserts. And we will get the tendons right after that. Attach on bone, so we don't want to leave them out.
Why cocoa butter? Is that what's recommended for guys?
No, there's actually an ointment, but they come in such small
Oh.
jars. We run out quick,
Yeah,
and
that's just easier.
this is good for the skin, and most people like it.
Yeah, I was just curious. There's a
Yeah.
reason.
Worst case.
Yeah.
All right. And yeah, when I get to like some of the triceps area, that's not gonna be pleasant. Okay.
When do I get good news? When I leave?
When I say we're done,
Okay, that's it. Okay.
you asked for this.
I know.
Gosh. I should put a disclaimer. This is a special occasion. Do not do this many muscle segments in one session. Okay. All right, so with the biceps also brachial artery, so we just gotta make sure we don't damage it. So we just go a little superficial, get the fascia in the area, at least for this visit. Okay. Yeah. Yeah. And that's literally, I'm just,
I know.
Not even
I'm
the-
fully aware this one's way lighter.
yeah. Okay.
Sorry.
No.
Defense stance.
This tool is intended for this one, right? It gets right in those wrist flexor extensor muscles. Goes right over it, yeah. Dude, you can just hear it. So a lot of tendons here, so we don't really need to go crazy. Hi. It's fitting that it's almost Halloween with this. Yeah. thought you would, honestly.
Well, it's nice to hear.
The biggest, scariest, buffest guys are the biggest babies. Just oh my
Most men
god.
are.
Just no, you guys don't understand the pain we go through when we have a common cold, okay?
No, I know. But like any massage therapist, like men are wussies. You
Yeah.
guys are just let's just be honest.
Everyone like turns into a baby when we're sick. It's the funniest. Yeah, we're just
Big babies.
wow right there.
So next time, I usually come a week at a time.
Mhm. This much work, I would at least take 2 weeks off.
No, I know. I'm saying for my next visit.
I want to give a shout out to my patient who was awesome enough to let us record this, and she didn't scream at all. Okay, so
Just my grimacing face.
comment which muscle group you think you need this done to at most, and or what would you like to see next. We're always trying to please everyone with what they're expecting and wanting to see on our page. So, all right, we're gonna wipe her down and then unleash the Kraken. All right, what's up? There you go. Jeez.
Spent a lot of time in the heels this weekend.
Okay. I bet. Ankle feels good. Tender, right? Let it go. Good. Hold on, got lightheaded.
It's alright.
This is why I eat all day. I need the energy. There's a lot of calories being exerted when you unleash the Kraken. Did anyone bring us portals today? No?
Not yet.
Not yet. Let it go. Good. Okay. Give yourself a hug. This is okay? Yeah. Breathe in. All the way up. Drop, drop, drop. There we go. Breathe. I'm telling myself that. You could relax. One more. Out. Drop it down. Let it go. Good. Can we do it like this? Okay. Bend your knees. No, that's just when I tell you lift your hips off the table, okay? Your left, huh? All the way out. Breathe in. Out. Lift off the table. Drop, drop, relax up. There it is. Yes. Okay. You alright? Okay, let's go on your side, face me. Running out of space here, Stacy. We could Graston that too.
I'll probably use
We'll just talk about it later. Let go of the hip. Relax. Good. All the way out. Jeez. One more. Out. Out. Breathe.
I'm trying.
All right, we got to do a kick move on you then. It's okay. Calf spasm.
Sorry.
Don't record this stuff.
It's called bloopers.
Well, I've told them we should, for years, like segments called Candid Chiro.
Right. I like it.
But with HIPAA, with all these patients running, it's very hard to get something compatible or compliable. Is that the right word? Okay. Other side. God dang.
Doctors need treatment. Don't forget this wrist though.
I'm coming. I'm stretching. Oh, cramp. Dude, I need a banana. Someone get me coconut water. Ooh. We'll get this wrist. Oof.
See, I needed it.
Again, you're not slippery or anything, just with the ointment we had for Graston. Yep. Good. Breathe, just keep breathing. I'm gonna slowly stretch you. Deep breaths in. Out. You okay? This is all I'm gonna do right there. Breathe in. Out. One more. Good. Good.
Oops. I'm off the table. Okay, here we go.
Good. One more. All the way out. Breathe. Good. Baby shift. Comfortable? Comfortable? Mm-hmm. It's not choking you? Okay, we're gonna breathe in and out through your nose and make sure you're not biting your tongue, all right? Out. I'm gonna stretch you more than usual. Breathe in. Out. Good. Breathe in. Out. Cool. Yeah.
Hello.
Hi. Definitely went down.
Got a good one?
Yeah.
Readjusting my jaw.
Hold on. Let me just, since we did all this work, let me just make sure we got these ribs open. Open your arm like that. Close. Good. And just relax. Keep breathing. Out. Good. All right, other side. Did you not feel your whole spine go?
The shock of it, I don't even know what
Really?
happened. Yeah.
And then we got the low back to go to.
Yeah, I couldn't hear anything because
I felt
I
it
was
more
just
than I
taking
hear
it
it
all in.
because it's just so tight. Yep, I know. One more. Okay. Let it go. Good.
I'm getting a massage after this, so I'll work out my chest.
Good. All right, let's have a seat here. Actually, do you mind if...
Go for it.
There you go. Good. Left. Awesome. Okay.
was just telling the doctor last time I came here, which was my first time, that I left her almost in tears. Like I called my husband and like I was so choked up because I could finally be able to like turn my neck for the first time in like 20 years. And just the fact that I thought there's somebody that actually can help me. And this is my second visit and I already feel that much better. So I'm so grateful for this doctor, for loving what he does, caring, and doing way more and beyond any doctor I've ever met.